Today we welcome Dr. Fouad, a board-certified plastic surgeon with more than 22 years of experience in aesthetic and reconstructive plastic surgery. Graduated from the University of Amsterdam and Brussels. Can you tell us a little bit more about the kind of specialized surgeries that you do?
First of all, thank you for coming and welcome in Prometalia Clinic.
Thank you.
Actually, I do more than reconstructive surgeries, burn surgeries, and more to aesthetic surgeries now, like abdominoplasty, mummy makeover, and liposculptura. And of course, there's too much difference between liposuction and liposculptura, so latest also I've been doing interplayplasty, especially that here in Tajikistan, very rare gynecologist was doing some old techniques and method of interplayplasty. So now we are talking about the new techniques, new methods, more aesthetic, and it become now it's a specialty now as an aesthetic gynecology. And this is a new specialty that I started to teach it in some universities.
Okay, very cool. Okay. How did you decide to become a plastic surgeon?
Oh, it's a long story. I become from Lebanon, and because of the war in Lebanon, and at that time I was a volunteer in the American hospital. And I put it in my mind I want to be a doctor, and after I want to be a surgeon, and then because of what I saw and the period we passed in the wartime in Lebanon, so I decided from that time I want to do reconstructive surgery because I want to help as much people as I can. And of course I participated in many countries' war, doing surgeries for casualties, for soldiers, for civilians, of course, because of war time. The last one, it was in Armenia, between Azerbaijan and Armenia, and I treated a lot of soldiers because of phosphor burns by new methods and technique of fish skin grafting. Instead of doing skin grafting, so we do it by fish skin.
Yeah, I've heard about this.
Yeah.
Okay, cool. What are the most popular procedures that most people get nowadays?
Facelifting, breast implants, abdominoplasty, liposuction, interplayplasty.
Okay. What's the most popular in Tajikistan?
All.
All?
Yeah,
everything?
all. Sometimes the patient, she want to do all in one time.
Is that possible?
Yeah.
Yeah.
I have a patient inside already. We did it yesterday. Breast reduction with abdominoplasty, liposuction, and vaginoplasty same time.
Combo surgery.
Yeah.
So you've been in this profession for a long time. Can you tell us how have beauty standards changed over time?
Beauty centers changed a lot, and some of them are just marketing and just let's say commercial, and some of them are really doing a good job. So that's why, if you remember, a few months ago, some program was in the TV, and there's a big fight now between the Ministry of Health and some cosmetic clinics and some beauty salons, and I don't know what, who doesn't have any license, or cosmetologist just study 3 months and she started to do injections and surgeries. And I was surprised that somebody started to do blepharoplasty, nose job, and she's just a cosmetologist. So there's a lot, but in Tajikistan, it's only 11 centers who have the license.
What surgery do you consider the most enjoyable for you to perform?
All.
Everything. What about the most difficult?
Difficult when the patient is very obese, like more than 120 kilo, and most of doctors they don't like to do it because it's more high risk, but I take the risk, I do it. If the patient is very well prepared by the blood test, by the examination, everything is okay, we do our maximum to give the good results.
Okay. Have you ever refused to perform a surgery?
Yes.
Which surgery?
Many times. 3 people, I say to them, no.
Why?
Just go home. Who bring me a picture and she want to be like Shakira. It's impossible. I say to her, sorry, go home.
Yeah.
The second patient who come with complications, and she have a lot of complications, I say, sorry, you cannot do because you have many complications
It's
and you need a
dangerous,
lot
yeah.
of things and high risk. Third person who doesn't need anything, she just have mental issue. I said to her, no, go home. 80% of the plastic surgery patients have a psycho problems.
I wanted to ask about that.
80%, not only here, everywhere in the world. 80% of the patients who have a psycho problems from either from self-confident or she doesn't believe in herself, or people just they make fun of her sometimes and she's okay, but she put in her mind that I must change something.
Yeah. How do you help those kinds of patients?
I talk with them sometimes. I convince them. I tell them, listen, sometimes you have a risk, you have a problem, you might have this. Sometimes I show them very bad pictures, just to understand that you may reach to this point, and then okay, and then I'll think about it, and then they go.
What are some common myths you can tell us about plastic surgery? What do most people think about it that is not true?
Look, some patients, they expected more than what they think. That's why sometimes we have some problems with some patients. Not only me, many plastic surgeons, they have the same problem. That's why we try to explain maximum to the patients. That's why we do the consent form. They sign on it before we do the procedure, that they have to understand that you might have this complication, this is the complication. Your body figure, not what you think it's gonna be. So your body figure can be like this, it can be like this. So never give 100% to the patient that 100%, because they take the word, they put it in their mind. You told me 100% is gonna be like that. So you promised me. So that's why, yes, we promise we do a good job. We promise that we take care of you. We promise we do our maximum. But I cannot promise you 100% you're gonna be the same figure, because your body organism different from your sister body or from somebody else's body. Like two ladies, they come to me, one with her sister, and she wanted to take fat from her sister to put for herself. I told her, who told you? They said, I went to the cosmetologist, she was going to do that. So this is the big mistake, because medically it doesn't work. So I don't know how she wanted to do it. So that's why the knowledge, the education for patient is very important, to understand that this can be, this cannot be.
Totally. There's some common complications that can occur.
Infections
mostly.
Yeah, and sometimes comes from patient, not from us also. When patient is living in very bad condition at home, and humidity very high, and she's not clean, she doesn't take care of herself, and yes, you might have some infection, and this is always we tell the patient that you have risk of infection. By the way, and this is very important information, that most of the antibiotics they bring it in Tajikistan doesn't work.
Why is that?
Especially if it's coming from India or from China. It doesn't work here, because the type of bacteria here is totally different from India. So that's why it doesn't affect, because already your immune system understands this antibiotic, so it doesn't work on it. So that's why we need to take something closer to Tajikistan, like Iran, like in Europe, like in some other like Russians, but not Indian, not the Chinese antibiotic, which doesn't work here.
They have different environments.
Yeah, ceftriaxone, you have ceftriaxone in many countries, but ceftriaxone, they get it from India, it doesn't work. It makes allergy for patients, or it doesn't work at all.
What's the difference between aesthetic and reconstructive plastic surgery?
Reconstructive surgery, it's a surgery which the people, they have difficulties and they have defects after post-surgeries or post-accidents or post-burns, for example, who was not treated in very good way. So you need to do reconstructive surgery like flap, like some skin grafting, like some other procedures to maintain the area or the body. For example, last time I did the lady who she did mastectomy. So when they removed her breast, they didn't leave any pouch for her to have any implant in the future. So we had to do reconstructive for her and flap, and then we had to do put an expander for her, and every week she had to come to inject some water to have the size, so we can put implant in the future. Some burn surgeries, for example, people I have seen a lot of burns, and they come with a very bad scar. So this we have to do reconstructive surgery for them. Aesthetic, who's the normal people who doesn't have any problem there, but just they want to do some enhancements, some changes, or they need some because of age. They have pitosis, they have something. You have to do some surgery in a very professional way, very aesthetic way.
Right now, it's become popular, the use of fillers and Botox. What's your opinion on this?
Look, fillers or Botox have their own job. For some people who doesn't need to have any surgeries, you can do some Botox, some fillers, small amounts. But also, again, about fillers, it's a big problem because many people, they go to salons and they do very cheap fillers. But they don't understand that this filler is not a filler. It can be synthetic, it can be some other things, and it can be very harmful for the body. Especially, we had some patients, they come here for consultations. I was surprised that they were injected Vaseline. And they come with very big bruising and
swollen lip.
Not just swollen, necrosis. And we have to do some surgery for them to remove all and clean and do another lips for them. But yes, every kind of aesthetic or plastic surgery, it have advantages and disadvantages.
I heard that Botox can also be used therapeutically, not only aesthetically.
Of course, I used in my abdominoplasty. When I do abdominoplasty, I inject Botox in the muscular area to relax the muscles for at least 1-2 months, so the patient can take a very nice body form.
I also heard it helps for migraines.
Yes, of course, for migraine, for pitosis, for many things, for acne treatment, for scar treatment. You can use it in the surface by microneedle, not just injection. But some people, they do injections, but it doesn't work on them. Why? Because the zinc in the body is very low, and that's why they don't see results.
So you should be taking zinc supplements if you're going to do Botox.
And some people are afraid. You remember?
Yes.
The lady, she fainted just because she had phobia of injection, not because of Botox. So that's why you have to understand the patient.
What advice would you give to people who are considering plastic surgery?
Who want to study plastic surgery or who want to do plastic surgery?
Let's say who want to do plastic surgery.
Who want to do plastic surgery, I advise you. Choose your doctor and the right profession, person who is doing a good job. Don't go to a cosmetologist. She's not a plastic surgeon to do any plastic surgery procedure. For plastic surgeons, do microsurgery, do pediatric microsurgery because it's still very rare. And go ahead, who are studying gynecology, go do intimate gynecology, intimate plasty, because this is going to be the next future of aesthetic gynecology. And as you see, aesthetic gynecology, and I just came from a seminar in Georgia, which is also aesthetic gynecology, labiaplasty workshop. It's a special workshop. And you can see here also another one, which is vaginoplasty, perianoplasty, vaginal threads lifting and tightening without surgery. No need to cut. A few days ago, I had a hemorrhoid surgery for a lady without cutting, without doing anything, and she go walk, and next day she go to her work. So this is the advanced aesthetic procedures, hemorrhoid with no surgery. Of course, the cosmetic gynecology conference was held in Georgia, and we will welcome you again next year, maybe in the next conference, which will be held in Tajikistan in May 25. It's going to be the largest and the biggest Central Asia aesthetic plastic surgery and aesthetic gynecology in Karabulo University, Karabulo Medical University, with the support of the Ministry of Health and the Minister himself. So we will be welcome all the medical doctors who are interested in plastic surgery to join us. Minister of Health, Deputy Minister of Health, the President of Karabulo and me.
Can you finish the interview with 3 words? Anything you would like to say?
Be careful, Don't run and do plastic surgery if you don't need it. And again, choose the right doctor to do your procedure. I have seen a lot of surgeries that done in very bad way. So be careful, and you are beautiful always. Just think about that.
All right. Thank you so much.
Thank you.